All right, let's jump into a deep dive that's super relevant for all you future nurses out there.
Definitely.
We're talking about sexually transmitted infections,
Right.
STIs. But to keep things focused,
Okay.
we're zeroing in on the ones you're most likely to see when you're
Yeah.
providing that fundamental nursing care.
Makes sense.
The ones that show up with vaginal discharge, cervicitis, and genital ulcers.
Okay. So, you might be surprised to learn that STIs can often hit women harder than men.
Oh, really?
Yeah. We'll unpack why that is as we go along, this whole biological sexism thing.
That's interesting. Okay, well, let's start with infections that are characterized by vaginal discharge, so basically vaginitis.
Right. Inflammation of the vagina.
Exactly. And the usual suspects we're talking about here are...
Candida,
Oh,
which is a fungus.
uh-huh.
Trichomonas, which is a protozoa, and then Gardnerella, a bacteria.
So we've got the whole spectrum of microbes.
Yeah, and what's fascinating about the vagina is its like delicate balance of all these microorganisms. Even the slightest shift, can lead to an overgrowth and bam, infection.
So with Candida, a lot of patients will call it a yeast infection.
Yep.
Super common, right?
Oh yeah, 75% of women experience it at least once in their lives. And things like pregnancy or taking antibiotics can really tip the scales.
Makes sense. So what are patients saying when they come in with this?
You'll hear them describe the discharge like thick, white, clumpy. Some even say it looks like cottage cheese.
Oh, okay.
Plus, it can get pretty uncomfortable, itching, irritation, the whole 9 yards.
So not fun.
Not fun at all.
All right, well, let's move on to trichomoniasis,
Okay.
which wins the award for the most common non-viral STI.
It does. And here's something really interesting about this one.
Okay.
It can actually live on surfaces,
Right.
not just through sexual contact.
Wow, that's important for us to know.
Definitely. And men, they're often asymptomatic carriers.
Oh, no.
Yeah, so patient education here is really crucial.
Yeah, for sure. So clinically, what are we looking for here?
Think frothy discharge, often greenish yellow, and a strong, sometimes foul odor.
That's pretty distinctive.
It is. And don't forget, having trichomoniasis can increase a person's risk of getting HIV.
Oh, wow. Okay, so these infections are really interconnected.
Absolutely. Now, onto bacterial vaginosis, BV for short.
Okay.
This one's kind of a mystery. We don't fully understand what exactly causes that shift in the vaginal flora, but we do know that douching and having multiple sexual partners can up the risk.
I see.
Clinically, you often get that classic fishy odor.
Oh, right.
That can be a real giveaway during assessments.
Okay, so with all of these vaginal infections, it sounds like prevention is key.
Definitely. Educating patients about good hygiene, wearing breathable clothing and ditching those douches, super important for a healthy vaginal environment.
Yeah, empowering women with knowledge, right?
Exactly.
Okay, so we've covered infections with discharge.
Right.
Now let's move on to infections that cause cervicitis, which is inflammation of the cervix.
Got it. And the two usual suspects you'll see in practice are chlamydia and gonorrhea.
Okay.
Chlamydia actually takes the top spot, most commonly reported bacterial STI in the U.S., and the highest rates, you see them in young women, like 15, 19.
Wow, that's really young.
It is. And one of the biggest challenges with chlamydia is that it's often, asymptomatic.
Well, they don't even know they have it.
Exactly. And that can lead to delayed treatment, and then you get complications like PID, even infertility.
So those yearly screenings for sexually active women under 25.
Huge.
Yeah, make a big difference.
Couldn't agree more. Catching it early is key.
Definitely. All right, so what about gonorrhea?
Gonorrhea, another bacterial infection that can cause cervicitis.
Okay.
And this one, it's a bit of a quick change artist.
Yeah.
It develops resistance to antibiotics really quickly.
Oh, wow, that's scary.
It is, because if it's not treated, it can lead to PID, infertility, even spread to the bloodstream. That's very serious. And for all you future nurses out there, remember that gonorrhea can cause a nasty eye infection in newborns, ophthalmia neonatorum.
Right.
Your care and education can make a lifelong difference for those babies.
That's a powerful thought. Okay, well, speaking of serious consequences, let's talk about infections characterized by genital ulcers.
Okay, sounds good.
So first up is genital herpes,
Right.
a lifelong viral infection caused by the herpes simplex virus.
And here's the thing. There's no cure for herpes.
Oh, wow.
And what's even more concerning is that most people who have it, they don't even know they're infected.
And you said it can be transmitted even without sores?
Even without visible sores.
Wow. Okay, well, that's definitely something to educate patients about.
For sure. And the impact of a herpes diagnosis, the anxiety, the fear of transmission, the stigma, it can be a lot to deal with.
So compassion is key here.
Absolutely.
Okay, well, let's move on to another infection that's been around for a long time, syphilis.
Right. It's actually been making a comeback in recent years.
Oh, really?
Yeah. And understanding the different stages, that's essential for nurses.
So break it down for us. What are the stages?
So syphilis goes through primary, secondary, latent, and tertiary stages.
Okay.
In the primary stage, you'll often see a chunker, which is a painless ulcer, usually at the site of infection.
Oh, I see.
It's classic, but easy to miss if you're not specifically looking for it.
And what about the later stages?
Well, secondary syphilis can be a mixed bag. You might see a rash, fever, swollen lymph nodes.
Okay.
Then there's the latent stage where there are no symptoms, but the infection is still hanging out in the body.
Oh, wow.
And finally, you've got tertiary syphilis, and that's where things can get really serious. Life-threatening even, with damage to the heart, brain, and other organs.
So early diagnosis and treatment are critical.
Absolutely. And speaking of complications from STIs, have you heard of Pelvic Inflammatory Disease? PID?
Yeah, but can you break it down for those who might not be familiar?
Of course. So picture this. The infection starts in the cervix, and then it decides to go on an upward journey, affecting the uterus, the fallopian tubes, even the ovaries.
So it's like a traveling infection.
Exactly. It's an ascending infection.
Right.
And the symptoms, they can be kind of sneaky. Abdominal pain, fever, unusual discharge, that kind of thing.
Okay, so again, early diagnosis and treatment to prevent those long-term issues like infertility.
You got it. As a nurse, you'll be on the front lines, recognizing those subtle signs and making sure your patients get the care they need.
It's all about advocating for our patients, right?
Yeah, absolutely. Now, for a bit of good news in the world of STIs.
Yes, please.
Some of them are vaccine preventable.
Oh, that's fantastic.
Right. We've got some weapons in our arsenal, and it all starts with education and a vaccination. We'll dive into the details after a quick break.
Perfect. Looking forward to it.
Yeah.
Okay, so let's talk vaccines. Which STIs can we actually prevent this way?
Well, one of the biggest game changers has been the HPV vaccine.
HPV?
You see, almost every sexually active person will get HPV at some point.
Really? I had no idea it was that common.
It's incredibly prevalent.
Wow.
But here's the good news. Most HPV infections clear up on their own.
Oh, that's good.
You don't even know you had it.
Okay.
It's only certain types of HPV that can cause problems, like genital warts or certain cancers.
So that's where the vaccine comes in.
Exactly. It targets those high-risk types, the ones that can lead to those serious conditions.
Makes sense.
It's been huge in preventing cervical cancer.
Wow.
And nurses, you guys play a vital role in promoting and administering this vaccine.
Absolutely. A real chance to make a difference.
It really is.
Yeah.
And while we're talking about vaccines, we can't forget about hepatitis A and B.
Right, but those aren't always considered STIs, right?
Well, they can be transmitted sexually, but they can also spread through other routes.
Yeah.
Hepatitis A, that's mainly through contaminated food and water,
Mm-hmm.
while hepatitis B, that's through contact with infected blood and bodily fluids.
So it depends on the individual's risk factors.
Exactly. It's all about assessing those risks and then, tailoring the education and prevention strategy.
Yeah, that makes sense.
And speaking of serious viral infections, we have to talk about AVIDs.
Okay, yeah, that's definitely a big one. And I think a lot of nursing students might feel a little intimidated by it.
I understand.
It's a complex issue.
It is. HIV it's more than just an STI. It's a global health crisis.
Yeah.
Millions of lives impacted.
Yeah. So how does HIV progress? What do we as nurses need to know?
Well, HIV attacks the immune system,
Mm-hmm.
specifically those CD4 cells, the ones that help our bodies fight off infections.
Okay.
In the beginning, there's this acute infection phase, kind of like the flu, often goes unnoticed.
Oh, wow.
Then you enter this period where the virus is replicating, but you might not have any symptoms, and this can go on for years.
Wow, so it's silently spreading.
Exactly. But eventually, as the virus weakens the immune system, it progresses to AIDS.
AIDS. Oh,
And that's defined by a CD4 count below 200. And you start seeing these opportunistic infections.
and monitoring those CD4 counts is really important.
Absolutely. They tell us how well the immune system is doing. But there's good news.
Oh.
With antiretroviral therapy, RT, HIV has gone from a death sentence to a manageable chronic condition.
That's amazing progress.
It really is. But managing a lifelong drug regimen like ART, it's not always easy.
Yeah, I can imagine.
Adherence is key, but there can be so many barriers.
Right.
Think about the counseling skills needed to support patients, address their fears, navigate side effects, empower them to take control of their health.
Yeah, that's a lot.
It is. And then there's the added layer of pregnancy. Mother-to-child transmission is a real concern, but we've got ways to reduce that risk dramatically.
Like what?
RT, formula feeding instead of breastfeeding, and certain precautions during labor and delivery. All these things can make a huge difference.
It's amazing what we can do now.
It is. So we've covered a lot of ground here, from vaginitis to HIV/AIDS.
Definitely. And one thing that stuck with me is the idea that STIs often hit women harder than men.
Right, the biological sexism we talked about?
Can you explain that a little more? Why is that the case?
Sure. It comes down to a few things. First, anatomy plays a role. The lining of the vagina is thinner and more delicate than the penis, so it's easier for infections to take hold.
I see.
And because it's internal, infections can be harder to spot and treat early on.
Right, that makes sense. Anything else?
Yeah, the female immune response can also be a factor. Some studies suggest that women might not mount as strong an immune response to certain STIs.
Oh, interesting.
So they're more vulnerable to complications.
That's really important to keep in mind when we're assessing and educating patients.
Absolutely. Individualized care is so crucial. These infections can really manifest differently in men and women.
This has been so insightful. Thank you.
You're welcome. It's been my pleasure.
We've learned about the biology, the symptoms, the treatments, and the role nurses play.
It's a lot to take in.
It is, but it's been fascinating. So, any final thoughts for our listeners as they start their nursing careers?
You know, as you move forward in your nursing journey and get into practice, it's really important to remember that knowledge is power.
Right.
Especially with STIs. The more you understand about these infections, the better you'll be able to care for your patients.
It's so easy to get caught up in all the clinical stuff, but at the end of the day,
Right.
It's really about the whole person.
Absolutely.
Their physical health, their emotional well-being, their quality of life.
Exactly. And, you'll have such a huge impact as an educator and an advocate for your patients.
Yeah.
You'll be helping break down stigma, encourage testing and prevention,
Right.
and empowering patients to make those informed decisions about their sexual health.
I love that. Empowering them to take control, that's really what it's all about, isn't it?
It really is. And learning never stops, right? Stay curious.
Yeah.
Keep up with the latest research, the guidelines, and never be afraid to ask questions.
That's good advice for all of us, not just nursing students.
For sure.
So what surprised you most during this deep dive? What really resonated with you?
I'm always struck by how many STIs are asymptomatic.
Right.
Especially in women.
Yeah.
It just highlights how important those routine screenings are.
Definitely.
And having open, honest conversations with patients about their sexual history.
Yeah, they're risk factors.
We can't just wait for symptoms to show up.
Right. Got to be proactive.
Exactly. And another thing, we talked about trichomoniasis, increasing the risk of HIV transmission.
Right.
But the connections go way beyond that,
Yeah.
like HPV and cervical cancer.
It's all interconnected.
It really is. So we need that holistic approach to patient care.
Absolutely.
We can't just focus on one infection in isolation.
The big picture.
The big picture.
Yeah.
And as future nurses, you have the power to make a real difference in your patients' lives.
Yeah.
Your knowledge, your skills, your compassion, it's all so valuable in this fight against STIs.
This has been an amazing conversation. Thank you so much for your time.
It's been my pleasure, really.
To all our nursing students and faculty listening,
Yes.
best of luck with your education and practice.
You guys are the future of healthcare.
What a great way to wrap things up. Thanks for joining us today on this deep dive into the world of STIs.
You bet.
We hope you found it informative and engaging,
Definitely.
and maybe even a little inspiring. Until next time, stay curious, stay compassionate, and stay committed to providing amazing care to your patients.